Hello, my name is Connor Jensen. I'm a graduate student in the Family and Child Life program at Central Washington University, and today I'm here to talk to you about reactive attachment disorder. Now, reactive attachment disorder is quite a rare disorder. Right now, there are not any kind of published numbers of how many children have reactive attachment disorder, because this is a very rare situation and a very complex and unique situation in which not a lot of kids are affected. The kids who are greatly affected by reactive attachment disorder are the ones during their attachment period from birth to about 9 months who were unable to have a consistent caregiver who would be there for them in order to alleviate stress, provide comfort, and to support those basic needs that a baby needs to develop and grow. So children that are often affected by reactive attachment disorder are children who were born and put into the foster system and moved around from different foster homes and a lot of different foster homes during that time of attachment formation. Another typical situation is when a child is born into an institution or an orphanage where there are too many children for the amount of caregivers they have, and there's an insufficient amount of care being given to that child, and kind of care that isn't always going to be there and may not be there at all. And then the third very typical situation is that the child was abused or watched somebody being abused consistently during that attachment formation period. So in order to diagnose, what would end up happening is that a parent or caregiver, in this case, would see that the child was displaying signs such as withdrawing emotionally, blunting their emotion. They would not seek out comfort or care from a primary caregiver when in distress. And this may lead to further emotional behavior problems as the child grows older and develops in their cognitive abilities and their language abilities as well. As the diagnosis process begins, what ends up happening is the child and the parent or caregiver will go to a pediatric psychiatrist or psychologist who will then do a series of observations and interviews with both the child and the parent or caregiver, in which they try to determine the child's history as well as current symptomology and then move forward from there. When a diagnosis of reactive attachment disorder is given to a family, their options they kind of vary at this point. Right now, it is seen that the most effective interventions with this population are interventions focused at the attachment building of the child, the system, the family system as a whole, and the relationships within the system, and then the parenting style that the caregiver has and relays on towards their child. When looking at considerations based on development, it's important to understand certain points that children will be at during their development. Early in infancy, you're not going to see diagnoses of reactive attachment disorder, because the diagnoses, or the DSM, the diagnoses of statistical manual or diagnostic. The Diagnostic and Statistical Manual of Mental Disorders. I apologize. That is the manual in which mental health professionals use to diagnose reactive attachment disorder, and it is important that the child is developmentally on a typical path to where they have created their internal working model of how relationships should be and how attachments should be in their family. So this process takes about 9 months for the child to really start building up an understanding of how they're going to be treated over time consistently. So after that 9 months of time, what will most likely be seen are the withdrawing, the inability to seemingly connect with their caregiver. They may seem distant, not interested in play or any of those opportunities. As they move forward into toddlerhood and early childhood, it's important to understand that their language abilities and their cognitive abilities are speeding up, but are not completely set yet. So as that child continues to grow, they're going to be facing more and more problems due to their want to understand and comprehend what's going on to them, except they won't be able to, and it takes time for that child to get to that point, which is going to more than likely cause behavioral issues, pouting, tantrums, and other behaviors such as protest, lack of exploration, and so forth. As it moves on and late into middle childhood and forward into adolescence, it's important to understand that the diagnoses aspect is not usually made after the age of 5 years old. Much of the symptoms are easily seen before 5, and it's easier to come up with that disorder, but as you get older, there are more explanations that could possibly be in line with this reactive attachment disorder that's not reactive attachment disorder, and so you typically don't see any kind of diagnoses past that point, but care for previous reactive attachment disorder will continue upon building relationships with caregivers, forming new internal working models of the world around them and how relationships work, and then most importantly, it's going to understand that there's going to be behavioral aspects that are going to be difficult during the care. As the child gets older, their ability to physically and emotionally outburst becomes that much more developed and easier for the child to lose that emotional regulation control. Now, as far as online resources for families, the 3 I found were smarterparenting.com, the mayoclinic.com, and attachmenttraumanetwork.org. Now, the first 2 I mentioned are simply just frequently asked question type areas to go, different facts about reactive attachment disorder, different treatments, interventions, what you should look for, doctor expectations, such as those things that a parent might not think to come up with on their own, but are there for them. Now, the last one, the Attachment Trauma Network, is in fact actually a network for parents to go to find care in their area. So this website helps the parent to find specific care for their child within their close range and area to make it easier for the child. Now, in the conclusion of this video, I just want to spend a little time watching a video I've found. This is a therapist named Katie Morton, and she has a YouTube channel in which she talks about various mental disorders. In this 3-minute clip, she goes on to talk about different treatment options specifically for reactive attachment disorder.
Now, there are 4 treatment options that I'll talk about, and the first, I'm just looking at my notes because I take notes, is family therapy. And it's just like what I said, because the situation is usually occurring in the family or has occurred in the family, it's important for the whole family to work together to start talking about it, especially if there's more than one child. Chances of the other children having it too are very high, and so we want to make sure that we're changing the way the family interacts, the way the family talks about it, and just overall improving their function as a whole. The second option is individual therapy and or play therapy for the child. This can be great, and I always, if it is one child who's really struggling, I would always recommend that they get their own therapy or play therapy, because sometimes in family situations, as children, they can feel fearful of speaking up because of what may happen in the family, and so giving them that one-on-one time can allow them the support and guidance to talk about what's really scaring them or what really happened and get the help that they need. The third treatment option, and something that I actually used to teach, funny enough, is parenting skills classes, and these can be everything from how to manage an infant and ways to better deal with that to how to properly discipline a child, and even, I used to teach these, how to manage teenagers. Because we know it can be hard, right? And so they may want you to take a bunch of different ones. They may ask the parents to talk about disciplining a child, especially if there's abuse present or if it was a trauma related to something like that. Also, they'll make you take communication classes and better ways to communicate with a child. All of those different types of classes are available, and those are things that may be forced upon you through legal action or something that you may get from your therapist that you're seeing either in family therapy or in individual therapy. And the fourth and final treatment option, and it's not so much a treatment option as it is just extra support and aid, is special education services. if your child is in school, there are so many different things. I know I've talked about IEPs, which are individualized education plans. There are a lot of things that schools can do to better support your child if they're struggling, because reactive attachment disorder can mean that they don't even pay, they might not pay attention, they might struggle to pay attention, they might be really shy, they might not make friends. School may be a really difficult area for them to be in, an area for them to navigate, and having some support in the school system can really, really help.
All right, well, I just want to say thank you so much for joining me in this presentation, and if you have any questions, feel free to reach out as we go further. Thank you so much, and have a wonderful day.